Okay. First of all, I just want to inform everyone that the majority of the lectures are going to be posted on our YouTube channel, which is the Audio-Vestibular Science Forum. Make sure you join us and you put on the notification bells, because I will not be able to every time we post a video to inform you on Facebook. So just press the notification button, okay? We're gonna wait for a few seconds before we start. And the presentation today is presented by our lovely Nour. So, Nour, can you hear me? I'm just going to check with you because you're the only one who should be talking. Can you hear me, Nour?
Yeah, I can hear you.
Perfect. Can you please inform us if you're all able to hear Nour?
Is my voice clear?
Me?
Okay. Nour, what I'm going to do is, as agreed, I'm going to make you the host. So,
They're saying the sound is intermittent.
so let's check with you.
Your voice is intermittent to me as well.
Okay, so you officially became our host. Do you mind sharing with us your screen, please? So I'm going to introduce Nour. Hopefully everyone can hear me. She holds a Bachelor of Science in Medical Audiology from the American University of Beirut, and she's currently the clinical and technical specialist for Medel in Lebanon. Okay, Nour, I think we can share your screen, please.
All right. Share my screen. All right, so I'm guessing you can all hear me now and you're seeing the presentation on your screen.
Yes.
Okay, awesome. So welcome everyone. My name is Nour Aridi, and as Dr. Sino just said, I'm the technical and clinical specialist for Medel, currently located in Lebanon. So I will be giving you a presentation. It's going to be an introduction to CI, nothing too advanced. Maybe later on we can do something more advanced. And all right, we can start. All right, so we're going to talk a bit about Medel's mission. What is a cochlear implant? CI candidacy, electrode portfolio, and a bit about the fitting software. So first of all, as audiologists, we all want to overcome the hearing loss, which is a barrier to communication and the quality of life. And this is specifically Medel's mission. To effectively yet gently restore hearing by offering a set of intact skin hearing implant solutions and providing the best to individuals with hearing loss. This is a slide that will show you the beginning of cochlear implants till what we have right now. So I'm gonna slide it over here. You're gonna see it's gonna start moving. We have in 1975, the microchannel. Then as you can see in 1991, we have the world's first BTE processor. So you can see the evolution of implants, how they were big and now they're actually getting smaller and more advanced in technology. We can see how implants were first ceramic in material, now they're titanium, and how now we have BTEs, we have single unit processors. So this is just like a general idea of history of products. This is a picture of one of our very first patients. So you can see how this is the cochlear implant system that she's surrounded with. You can see the difference that we have right now. So what is a cochlear implant? This is, this is a 3D picture that I found interesting. So let's just review the parts of the ear. So we have here the external parts, as you all know. And then we have the middle ear, which is, we have the eardrums, we have the ossicles. Then we move into the inner ear, which is the cochlea. We have the semicircular canals, and then we have the auditory nerve. So let's watch a video that will give you an idea of what is a cochlear implant, or how do they work in specific. Right, I hope this doesn't take much.
Meanwhile, I just want to ask a question. If everyone is, can everyone let us know if they see cochlear implant patient and chat? This way, we will be using our time wisely.
Yeah, sure. So let me know if you actually see cochlear implant patients. Yes. All right. If you also want to mention what country are you from, or are you in a hospital setting, in a clinical setting? I'm gonna try to just load this off from YouTube. Maybe this is better. Oops.
We have plenty of participants from India, Pakistan, Portugal. A quick question, because I don't know how things happen there, waiting for the connection to happen. Is the government paying for the implant or the person himself? That would be an interesting topic to
yeah, coverage.
Coverage, yes.
India, we have Palestine, Portugal. Awesome. Pakistan again. The government pays.
Okay, Nour, maybe we can continue, or were you able to get it from a different site?
Yeah, now the video works.
Perfect. Let's move to
so
it.
Let's
please.
try. I don't know why it's taking this much.
Apology for the delays.
All right. Yeah, I'm playing it directly from YouTube. Government pays here.
Okay. No, let's talk about it very briefly. Meanwhile,
all right.
Okay.
Well, if you want to watch the video later on, it's you go on YouTube and it's how do cochlear implants work, and it's it explains to you. So basically, a cochlear implant is a device that is surgically implanted, and this device bypasses the normal acoustic hearing process that we usually have, and it directly stimulates the auditory nerve. And it has an external part which is born outside, and it has an internal part which is the actual implant, which is surgically implanted inside. I hope maybe at the end of the lecture, maybe we can watch the video again.
ما ينسمع صوتك كلش.
ask something?
No, we're gonna, they're saying that your voice is not very clear. Okay, let's,
مستخدم حسين إيران عريفي.
hello, sir.
Shanghai.
Okay,
Sound is
shall I?
not.
Yes, I'm gonna be muting everyone, just a second.
All right. Can I move on? Is everyone on the same page?
Please go ahead.
All right. Okay, so now let's talk about the candidacy of cochlear implant, who can get it and how. Here are some general accepted guidelines, which is usually a severe to profound sensory neural hearing loss bilaterally. We have we need to have a functional auditory nerve, or else we can't. There is nothing to stimulate. And usually, word discrimination scores (WRS) are done with the hearing aids if the person wears bilateral hearing aids, and if the score is less than 50% in the best aided condition, then he's a candidate for a cochlear implant. This is the generally accepted one. You might find resources that tell you different numbers. No active middle ear pathology, and usually it's better if we have hearing aids fitted for a minimum of 3 months, to see if we have any benefit before we go into a surgical solution. 12 months or younger. So this is a debatable topic. All devices can be safely indicated for children which are 12 months or older. Most surgeons usually are comfortable with the idea of implanting kids below this age. It also varies from a country to another, from a hospital to another, and usually some surgeons like to follow European guidelines, some follow American guidelines, so it depends. In order to implant a cochlear implant, we need to have a full multidisciplinary CI team. And usually this consists of an audiologist, the ENT surgeon, a speech-language pathologist, a psychologist, which is usually rare to be present, but it's ideal if we have one. And also we have other specialists such as the behavior specialist, depends on every single case. Preoperative assessment.
Sorry, Nour, I need to interrupt. Can you go back on the slide? I'm not supposed to be interrupting, but one thing that is really missing here is a vestibular specialist. Audiologists, I really think are very important, but if a vestibular person is on board, is really unnecessary. This is coming from me, you know, my love of vestibular. I apologize for interrupting, but I really wanted to make it clear that vestibular audiologists, in addition to pediatric audiologists, are a must in a multidisciplinary cochlear implant team. I apologize again.
Also, even a pediatrician.
Sorry?
Hello? Also, even a pediatrician is missed. I think even a pediatrician makes a very important role in helping us referring the kids at an early stage.
I agree. Definitely the pediatrician is important.
Thank you for your input, both the vestibular and the pediatrician. This is definitely, I'm writing it down. All right, so I'm gonna move forward. All right, so first, what would be the role of the audiologist? Of course, to do the basic test battery, the tests that we do, which is the OAE, ABR, the unaided audiogram, and also the audiologist can assess the functional aided benefit when the person is wearing hearing aids. The surgeon, of course, they have to follow up with the audiologist. They usually do CT scans to see the anatomy, to see if we have any malformation in the ear, the cochlear malformations. They can see if the patient is fit to undergo general anesthesia and surgery, and also will work on determining the cause of hearing loss, whether it's associated with other syndromes or whether it's congenital or, acquired. And then we have the speech therapist, which